It's the second most common cancer among women in the U.S. While the annual rate of deaths from breast cancer is declining, it remains the leading cause of cancer deaths among women overall.
We know early detection is critical to survival. That's why we have Dr. Missy Wilson with Bon Secours Virginia Breast Center with us this morning. First of all, thank you so much for being here. First question.
Thank you for having me.
Of course. Tell us a bit about the risk factors here.
Okay, sure. So the way I explain it to people is you have sort of two different sets of risk factors. One set are things you can't control, like your genetics, your family history, your makeup. And so obviously we can't control that, but it's good to know your family history and know how to go about screening for your breast cancer due to that risk, which we'll talk more about in a second. And the other set of factors are things you can control. So, for example, things that would put someone at high risk would be smoking, excessive alcohol intake, different occupations can put you at increased risk factors, and so those are things that we can control. We often encourage patients to do routine exercise and to have a healthy diet and a healthy body mass, and so those are things that we can do something about.
What are the common signs and symptoms that someone should be looking for where they go, you know what, I need to go in and be checked out?
It's a great question. So first off, you want to do your breast exam once a month. Self-checks are very important. We're seeing a lot of women under the age of 40 that is too young to have breast cancer screening, and they're identifying it with their self-checks.
They're finding a lump or something.
Yeah, exactly. So just skin changes, skin dimpling, any skin discoloration, which includes redness or darkening, nipple discharge, or a lump.
And how often should you have a mammogram?
We advise without family history, so the average female starting at age 40 once a year. If you have a significant family history, you probably qualify for under age 40, and so you would come see one of us, so determine your risk and when you need to start annual breast screening.
Now the guidelines changed recently, right? So are we getting women in as they're younger?
Well, all of our societies have always recommended at age 40 yearly, starting at age 40. Mammogram is very effective at saving lives, and so you get a 40% decrease in overall mortality by starting at age 40. So,
and it's important to keep having those mammograms every year, right? Because what they're doing is comparing year after year after year, correct?
Yes, ma'am. And we really have no age cutoff. That's also
a myth.
Misinformation.
Yeah.
So some people think you get to age 75, we cut off mammograms. Not at all. If you're able to get out and go have your mammogram, you should go have it done every year.
What do treatment options look like?
Well, standard of care for breast cancer treatment is surgery, and that's what I do. So to remove the breast cancer, and then there are different modalities that we add after the surgery depending on the stage of the cancer, the type of cancer, markers, and different things. So main goal is to remove it and get everything out of there, and to do additional treatment to prevent it from coming back.
And if reconstruction is involved, is that a separate surgery that comes months later after healing? Is it all done at once?
It's all done at once, typically. So typically, like with a mastectomy, which a lot of times we spare the skin and nipple and use what you have from yourself for cosmetic reasons, then the plastic surgeon will come in and do their part of the reconstructive surgery the same time.
So it can all happen all at once?
Yes, ma'am.
Wow.
Anything else important for people to know about this?
I would like to add to know your family history, know your makeup. That is really important. We feel like in our societies we under-tested patients for genetic testing, and so it's very important to know your risk and know how we need to screen your breasts and how often we need to do exams.
So talk to your mom.
Talk to your family, find out what's going on in the family if possible. So yeah. So basically know your family history and do your breast checks and do your mammograms. So.
All great advice. Dr. Missy Wilson, thank you so much for being here today.
Thank you for having me. Thanks.